Artery. The venous system is fairly easy to do at this point because it's on the surface. And let's go back and look at a couple of things. We started at the heart and we worked our way out this way. The major vessel from the arms, head, and neck emptying into the heart is the superior vena cava or anterior vena cava, whichever one you want to use in here. Then it is formed from the left brachiocephalic, called innominate, and the right brachiocephalic, called innominate. The innominates are formed from, and you're going to see a vessel called the subclavian, which goes under the clavicle and out onto the forearm. A vessel that goes up the neck, the external jugular, and a tiny little vessel. In most instances, it will not be injected. But since there are 9 cats, the chances are at least 1 or 2 will be injected. But I'll show it to you. That's the internal jugular vein. The internal jugular vein is somewhere close to the common carotid artery, which we'll get to the arterial system. Right? Now, the subclavian gives rise to the next part of the vessel. As we go out, it changes its name to make it difficult for you. So we have subclavian, and then it becomes the axillary. As it becomes the axillary, it has 3 main tributaries. In the venous system, the connections in general are called tributaries, not divisions. The first division is this tiny little piece here. That's called the ventral thoracic. It also is formed from this vessel called the subclavian vein. Goes to the clavicle. And you have in this group of tissues here, you have the third part of the axillary region that is known as the long thoracic. Then it continues beyond that point as the brachial. So this is the brachial once those 3 branches are identified. And the brachial travels down onto the end of the humerus, and there is a branch that runs around the biceps and the brachialis muscle that's called circumflex. Most of them will not be injected. And then it passes down onto the forearm, and in the cat, the vessels are unique as they pass onto the forearm. This is a part of the circumflex here. This is a part of the brachial. Is a vessel that comes from the coracoid processes and the that region of the musculature of the scapula. It's coming from the backside of the neck and the scapula, and this is known as the transverse scapula. Now there is an artery right next to it, but that artery comes from a vessel that is on the backside of this. Let's see if we can find it. Yep, there it is. Artery. This is the vessel known as the thyrocervical. The neck and the thyrocervical. And the transverse scapular artery comes off of that vessel and parallels the transverse scapular vein. This is external jugular here. All right? Now, arterial system. You got your gloves on. You got yours on. Hold your thumb on that, please. Thank you. That's a little bit piece of fat on the aorta, and many organisms, many humans, develop it there as well. Now, in the cat, there are only two branches off of the arch of the aorta. The first branch is called the brachiocephalic, and the second branch is called the left subclavian. In the human, most humans will have three branches. The first branch is called the brachiocephalic. The second branch in the human is called the left common carotid. The third branch in the human is called the left subclavian. So the cat does have a left subclavian, but it does not have a left common carotid coming off of the aorta. Does it have a left common carotid? Of course it does, yes. And that comes off of the brachiocephalic. So the brachiocephalic in the cat has three branches. Subclavian artery going to the right side, right subclavian, the right common carotid, and the left common carotid. The common carotids, you can leave it now, thank you. The common carotids come up and pass generally parallel to the trachea. Now, did this one have a crossover? Arteries can be in strange places, but the strangest locations are for veins. Anybody had enough embryology or circulatory physiology to know how veins arise? Anybody? Veins arise to surround a channel through which blood is oozing. So if you lose one vein, another one can develop because the blood will find a channel to get back into the circulatory system. So veins can vary. Okay. Here we have this vessel is the external jugular. There is no internal jugular. I do see this is the right common carotid. Yeah. The left common carotid is not here that I see. That's not it. Is this it? Yeah, there it is. There's your left common carotid. And if you look, what's it from? That is the left common carotid. There it is. Right, left. that'll keep you busy for most of today.